Hello and welcome to the Spring 2022 Graduate Urban Planning Economic Development Studio presentation. On behalf of the studio, I would like to thank everyone attending our presentation today. The impact of COVID-19 on industries, public transportation, and commuting patterns. We recognize the effect that COVID-19 pandemic has had in American cities, and we analyze the social and economic implications of a disrupted public transportation system. This report focuses on the cities of New York, San Francisco, and Syracuse. Our presentation will begin by briefly discussing the importance of public transportation in regional economies, and introducing our cities and their public transportation networks. We will then give a more thorough breakdown for each city. This will include economic reports, data analyses, and literature reviews. And we will conclude with a set of city-specific policy recommendations. These recommendations are intended for the local transit authorities in our cities and aim to alleviate issues of equity in public transportation while addressing economic solutions to help generate revenue for the transportation infrastructure. At the end, we will discuss policy recommendations that are applicable to all three of our chosen cities, as well as other findings and concluding thoughts. Public transportation services are imperative to a healthy economy, as they provide access to employment, create jobs, and act as a catalyst for economic growth. At the same time, a strong economy is imperative for a sustainable public transportation.
For our policy methods, we conducted literature reviews to better understand the social and political atmosphere regarding our cities and their public transportation during the COVID-19 pandemic. 3 separate literature reviews were conducted for each city, since each has a unique context from the others. Sources such as government documents and proposed policies by local authorities provided insight into the measures our cities have taken or intend on taking since the first shutdowns in March of 2020. Analyzing peer-reviewed academic research and news articles were helpful measures in understanding the social implications of a disrupted public transportation system, as well as a useful metric to gauge the success of the policies our cities had implemented. Finally, economic reports sourced from local authorities and think tank groups were useful to understand the economic context our cities were operating in, and how the pandemic had impacted the revenue generated for local transit authorities.
Our research utilized a mixed methods approach. We utilized the American Community Survey 5-year estimates for 2019 and 2020 to collect demographic variables such as median household income, race, and commuting information for each metropolitan region. In addition, we utilized the municipal and metropolitan transportation authorities in each city to collect ridership data for their main types of public transportation. These sources were used to investigate the changes in bus, train, and bike share trends arising from the COVID pandemic. We also collected data from the Texas A&M Transportation Institute's mobility reports, which includes data regarding congestion and commuting data such as travel times for each city. To measure the impact that COVID-19 had on the economy, 3 PICS models were constructed for each city. One model demonstrated the economy before COVID, another one for during COVID-19, and another one that shows the change before and after COVID. These models are a modification of a traditional SWOT analysis, but utilize a growth and decline structure. This structure is imperative as it will help identify how the economic trends of each industry were changed by the pandemic. Each PICS model was constructed by combining the location quotient and GDP coefficient for each region's industries. The location quotient indicates the concentration of jobs in each industry in each area, whereas the GDP refers to the total value of goods and services produced. Both variables are measured in comparison to the larger entity of the United States. We utilize the Bureau of Economic Analysis full and part-time employment data to construct LQ. Specifically, the data from 2016 to 2019 to measure the general industry trend before the pandemic. The location quotient is then expressed as a ratio that demonstrates industry job concentration. A value greater than 1 would indicate a higher concentration of that industry in that region compared to the United States, whereas a value of less than 1 indicates a smaller concentration. To calculate each industry's GDP quotient, we utilize the Bureau of Economic Analysis real GDP data. Specifically, we utilize 2 ranges of years for data collection, between 2009 and 2019 and between 2009 and 2020. Using these 2 ranges helped identify changes arising from the 2020 pandemic. Simple linear regressions were performed for each industry, and their slope coefficients were used as the GDP coefficient. Industries that had a value greater than 0 suggested growth, while under 0 implied decline. These values were then used in conjunction with LQ to construct each PICS model. We then used these models to help calculate the top 5 industries in each city that were impacted by COVID.
Several analyses and maps were created to understand the spatial distribution of public transportation access in each metropolitan area with the use of ArcMap. All data and maps were represented and evaluated at the census tract level. The shapefiles for each metropolitan area were collected from TigerWeb, which is from the US Census Bureau. We also utilized each municipality's open data portal to collect shapefiles and other data that were not available from the US Census Bureau. The affordable housing for all 3 cities was obtained using the National Housing Preservation's database of registered affordable housing options in the United States. The reasoning behind the addition of affordable housing locations is to visually represent how public transportation plays a role in the housing decisions people who live in affordable housing make.
To get a better understanding of how our research topic affected individuals in our 3 subject cities, we decided to distribute a survey through LinkedIn, Facebook, and Instagram, as well as email over the course of 3 weeks to shape our research better off of the responses of individuals living and working in our 3 subject cities. Most of our respondents came from New York City, with the second most coming from Syracuse and the third most coming from San Francisco. The top 5 industries of our respondents were as follows: educational services, healthcare and social services, other services except government and governmental enterprises, arts, entertainment and recreation, and professional, scientific, and technological. 85% of respondents did not work from home prior to the pandemic. However, 68% of respondents worked from home during the pandemic. 51% of our respondents no longer work from home, and 27% of all of our respondents are working in a hybrid situation, which can be defined as working from home while also having days in which they work in their office. Our commuting times for our respondents varied, with most of them being between 0 and 20 and 20 to 30 minutes. However, this will be better understood through our breakdown of our 3 subject cities. The same goes for our commuting methods per respondent. You'll see that a majority of respondents responded that they either chose to use a personal vehicle or the train or subway. Again, when we break this down into each of our individual cities, it gave us a better picture of what transportation methods were being used for commuting amongst respondents.
Okay, our study area is the New York City metropolitan, including Manhattan, Brooklyn, Queens, Bronx, and Staten Island. This map shows the number of people with income less than 25,000 by census tract. The darker color is considered to be a low-income area, and we could see that most of the low-income areas are located in Upper Manhattan, Bronx, and Brooklyn. New York City's transportation density is positively correlates with the income level in most boroughs, such as Brooklyn and the Bronx. Manhattan is different in this situation for its special urban form, and we will go back to each boroughs later specifically. Here's the PICS model of New York City's industry. We summarize the top 5 industry impacted by COVID. Overall, COVID-19 slowed down the economic growth of New York City, but luckily most of the industries are still growing after COVID-19. And now my colleagues will talk about the industries individually.
Thank you, Jing-Yao. This chart indicates the top industries in New York City, expressing economic change during the pandemic. The accommodation and food services sector experienced its sharpest decline at 31%. Similarly, arts, entertainment, and recreation faced a 27% decline. The retail sector declined by 13%. This is due to the stay-at-home policies enacted at the time. The industry that faced the strongest level of decline was accommodation and food services, with a 31% decline. This decline is likely attributed to New York City's pause mandate. Policies assure uniform safety for everyone, enacted on March 20th of 2020. This led to the direct closing of many restaurants, bars, non-essential shops, and entertainment facilities such as theaters and concert venues. The most notable declines in people using public transportation to get to work from 2019 to 2020 were within the service of occupations, with a drop from 661,123 people to 615,664 people. Sales and office occupations with a drop from 615,426 people to 560,051 people. And production, transportation, moving material occupations, which went from 210,332 people to 197,084 people. This graph describes the number of people who report working from home in New York City in both 2019 and 2020. There is a visible decrease in work from home jobs in the management, business, science, and art sector. As the number of work from home jobs increased from approximately 240,000 jobs to 430,000 jobs, the service sector and sales and office sector also demonstrate increases. There is a minimal increase in work from home jobs in the natural resources sector and the production and transportation sector.
So here are a series of maps comparing the transportation change in each boroughs. We summarize the number of people who rely on public transportation and the commuting time in each census tract in both 2019 and 2020. The darker color is considered to have more people rely on public transportation, and the red dots represent the commuting time in those census tracts. In Bronx, areas close to Manhattan have more people rely on public transit. Most people in Bronx have to spend more than 40 minutes commuting, and after COVID-19, fewer people rely on public transit, and the commuting time remains the same. People who live in Upper Manhattan have the longest commuting time, mostly above 35 minutes. Fewer people are taking public transit after COVID-19, especially in the Lower Manhattan East. The commuting time also has slightly decreased. In Brooklyn, the average commuting time is longer than Manhattan. Borough Park, located on the south side of Prospect Park, is the only neighborhood with less commuting time than the rest of Brooklyn. Fewer people took public transit in 2020, but the commuting time has slightly increased in most census tracts. A similar thing happened in Queens. The total amount of public transit commuting decreased, but the commuting time has increased. Staten Island is different from the rest of boroughs. Both the number of people who rely on public transit and the commuting times has decreased.
And here are the GIS maps for low-income household, bus routes, and affordable housing in New York City. In the following 10 maps, New York City will be divided into 5 counties: Bronx, New York, Kings, Queens, and Richmond, to show and compare the distribution of low-income households, public transportation services, and affordable housing before pandemic and during pandemic. So the first 2 maps depicts the households earning less than $25,000 a year, bus routes, and affordable housing in 2019 and 2020 in Bronx County. According to the data visualization results, the low-income families in the Bronx are mainly concentrated in the southwest part of the area, near the Harlem River. Most of the affordable housing in the Bronx is concentrated in the southwest part of the area, and affordable housing tends to be concentrated in areas with high concentration of low-income families. By comparing the distribution of bus routes in 2019 and 2020, we found that the bus routes in the Bronx were basically unchanged. The pandemic had little impact on the bus routes in the Bronx, and areas with a concentration of low-income families could still use convenient bus services. The next 2 maps depict household earning less than $25,000 a year, bus routes, and affordable housing in 2019 and 2020 in New York County. According to the trend shown in the map, low-income households are concentrated in northeast and southeast of New York County along the Harlem River. And the distribution of affordable housing in that area is similar. It is worth mentioning that by comparing the distribution of low-income families in 2019 and 2020 and the legend value of the region with highest density of low-income families, we found that low-income families originally located in the southwest gradually moved out of the area in this year, and they tend to concentrate. However, the bus routes in New York have not changed greatly in this year. For example, as can be seen from the zooming maps on the upper right corner of the 2 maps, only 1 bus route along the Harlem River has been suspended, while the rest routes still maintain normal operation. Next, the 2 maps depict the distribution situation of low-income household, bus routes, and affordable housing in Kings County. The 2 charts clearly shows that low-income families in Kings County are mainly concentrated in the north, and the distribution of affordable housing is consistent with that of low-income families. By comparing the distribution of low-income household in 2019 and 2020, we found that within 1 year after the pandemic outbreak, the medium density clusters of low-income households in south and central part of Kings County gradually changed to low-density clusters, while some of the medium density clusters of low-income households in south area of Kings County changed to high-density clusters. By comparing the 2019 and 2020 bus maps, Kings County's bus routes were barely affected. And the 2 maps depict the distribution of low-income household bus routes and affordable housing in 2019 and 2020 in Queens County. As shown in the map, the medium density and high density low-income family clusters are evenly distributed in Queens County, whereas unlike the other counties, although the affordable housing in Queens County is in high density low-income family cluster, the number of affordable housing is small, and they continued to decline further in 2020. After comparing the distribution of bus routes in 2019 and 2020, we found that, like other counties, most Queens County bus routes are still in operation. Only a small number of routes have been suspended. Lastly, The two maps depict the distribution of low-income household, bus routes, and affordable housing in 2019 and 2020 in Richmond County. As can be seen from the map, low-income families in Richmond County are mainly concentrated in the northeast and southwest region. Affordable housing in Richmond County is concentrated in the northern and northeastern areas with high concentration of low-income families, and it is scarce. After comparing the maps of 2019 and 2020, we found that the high-density low-income family gathering area in northern Richmond County gradually changed to medium-density or low-density gathering area, while the medium-density gathering area in central and southwest area changed to high-density gathering area. Like bus routes in Queens County, most lines in Richmond County are operating normally despite the pandemic, with only a small number of them suspended.
Beginning in March 2020, subway ridership declined by 96%, bus transportation declined by 78%, taxi pickups dropped by 86%, and for-hire vehicle pickups declined by 60% in New York City. Bike share increased rapidly at the beginning of the pandemic in New York City as well. On April 30th, Governor Cuomo announced New York City subway closures from 1 a.m. to 5 a.m. for sanitation purposes. New York City later followed a 4-stage reopening initiative. Public transit usage increased steadily throughout each reopening initiative. On June 8th, New York City began its phase 1 of reopening. By June 10th, subway ridership had hit its highest level since the start of the pandemic at 851,241 riders. Subway ridership increased at this time by 28%. MTA crossings increased by 54%. Vehicle miles traveled increased by 78.9%. On June 22nd, New York City began its phase 2 of reopening. At this time, the New York City Department of Transportation developed the Open Streets and Outdoor Dining Plan. On March 22nd, 2020, in response to COVID-19 cases rising in New York City, Governor Cuomo enacted the New York City Pause Directive. This policy ordered all non-essential businesses to close in-office operations and to limit non-essential gatherings of people. During the beginning stages of the pandemic, there were also policies enacted that simultaneously decreased subway ridership and increased bike usage. The MTA adopted the Essential Service Plan on March 25th, 2020, which limited the capacity and service hours of the subway. On the same day, the bike-sharing system City Bike introduced the Critical Workforce Membership Program, which offered healthcare, transit employees, and first responders free rides for 30 days. The COVID-19 pandemic had large effects on access and equity in New York City. Neighborhoods in all 5 New York City boroughs with higher rates of COVID-19 were communities of color that had higher relative use of the subway and other public transit systems even after the social distancing policies were enforced. Essential workers relied more on buses and other services such as the MTA Essential Connector Program, which provided 18,870 trips in May. Subway shutdowns from 1 a.m. to 5 a.m. made it hard for essential workers who work odd hours to travel. There were also impacts on equity in New York City as well. Our research shows that people of color were statistically more likely to work essential jobs, which led them to be more likely to have exposure to COVID-19. Wealthier populations were able to avoid the spread of COVID by switching to working from home and utilizing food delivery services, ultimately being less reliant on public transportation. Studies showed that social distancing was harder to abide by in disadvantaged communities because of the sacrifices having to be made to continue making a living and to retrieve food and groceries from stores.
For New York City, we had a variety of individuals respond to our survey, which gave us a broad spectrum of what type of industries our survey respondents worked in. Prior to the pandemic, a majority of our respondents did not work from home. However, you'll see a major switch when the pandemic began and during the pandemic for those who did work from home. Now, on the right-hand side, you'll see the respondents who are still working from home. A majority of them are not. However, we have a larger number of individuals who are working in a hybrid situation. We also asked if individuals had changed jobs or careers during the pandemic. 62% of our respondents did say yes. We had varying reasons. However, we saw common themes amongst individuals who were unhappy with their work situation when the pandemic started, which caused them to change their career or job and work with an employer who better met their needs throughout the pandemic. The preferred mode of transportation before COVID can be seen on the left-hand side, and on the right-hand side, you'll see the preferred mode of transportation current. You'll see that their subway and train usage pretty much remained the same. However, bus ridership went down, as well as bicycle ridership. You'll see a small increase in personal vehicles. However, you also see the preferred mode of transportation currently that rideshare did pop up. Rideshare can be defined as both Uber, Lyft, or other rideshare services available within New York City. Our average commute time really varied amongst our respondents. You'll see that we do have a large number of people that fall between 0 and about 45 minutes. However, we did have a large number of respondents that commuted for between 50 and 60 minutes. We also conducted interviews. We had 2 interview subjects for New York City. These were 2 respondents from our surveys. Our interviewees expressed similar key issues, such as their workload when the pandemic began and why they both chose to change employers. And they also expressed issues with the New York City subway system. Both interviewees indicated that since the pandemic, there has been an increase of delays in traffic with the New York City subway system, which does impact their decision to go into their employer's workspace. If our interviewees chose to use programs such as bike share, it would be done for leisure purposes, and they did not use rideshare as they found it could be very expensive or inefficient, meaning that it took the same amount of time for them to commute through the subway system as it would by taking a rideshare vehicle. When asked, our interviewees did express that their living location was determined by their community more than their job, and that they would consider moving out of New York City because their jobs do have a remote option. However, they were unsure as what the future looked like for them because of the ongoing changes throughout the COVID-19 pandemic.
Based on our research, we have identified some short-term policy recommendations. With ridership numbers for the MTA and Central Business District economic growth slowly recovering, these short-term policy recommendations are aimed to increase ridership in public transit, as well as increase economic growth and equity. First, we recommend the MTA to create and implement incentives to increase employment for public transit jobs. Evidence from our interviews suggests that there has been a shortage of MTA workers since the start of the pandemic, which has led to delays and hesitation in using the public transportation system. Potentially increasing wages in addition to increasing COVID safety precautions may alleviate this. In addition to this, the MTA should increase efforts to spread awareness about COVID safety precaution measures on public transit. Another short-term recommendation is to increase bike share opportunities in low-income communities. The City Bike program was extremely useful in many areas of New York City during the pandemic, but may not have been always the most accessible for those living in low-income areas, particularly in some areas of Upper Manhattan, Bronx, and Brooklyn.
Based on the data, the analysis of that information, and the literature review formulated for New York City, the following policy recommendations are ways to potentially increase public transportation ridership while also focusing on transportation equity in the economy in all parts of the city. These recommendations are policies that would have to be slowly implemented over a longer period of time. We recommend that the City of New York focuses on developing more public transportation opportunities in low-income communities. This could be done by adding more bus stops on existing bus routes and extending bus routes to reach more low-income communities and beyond. Building more affordable housing near bus stops or subway entries, or offering incentives to existing housing establishments to have a higher percentage of units available to people with housing vouchers could also make it easier for people of lower income brackets to have better access to public transportation. This is an important recommendation to be considered because lower income communities in New York City, like Queens and Richmond County, do not have nearly as many bus stops compared to other parts of the city that consist of people with higher incomes. The MTA app could also be improved and updated in a way that would allow users to suggest where they think a bus should be added. The MTA could use that feedback to decide where to add more stops based on demand and the distance from other stops. If someone suggests a stop somewhat near another, the app could give that person directions to the nearest stop relative to the suggested location. There could also be a feature on the MTA app or a separate app funded through the government that provides cheaper ridership options for people with low incomes. This app would be a more affordable alternative to ridership companies like Uber and Lyft. Improving the infrastructure for walking and cycling throughout the entire city is also recommended. Sidewalks are not suitable for walking and cycling in some parts of the city or do not seem safe enough. Redoing the sidewalks, adding more bike lanes, and streetlights would help people who are dependent on these modes of transportation feel safer. Some recommendations to remediate the local economy after the hit it took due to COVID would be to create more jobs that require people to physically come back to work. Also to assist the central business district in economic recovery, since it is one of the areas that greatly contributed to the economy pre-COVID that took a really big hit. This can be done by promoting safe tourism while increasing foot traffic in the area once again. Bringing people back to work in person and increasing tourism will ultimately increase public transportation ridership, which in the long run will stimulate the economy. Another economic specific recommendation would be to incentivize and encourage new business development in low-income communities. More businesses opening in these communities would provide more jobs in the area, allow easier access to necessities that were harder to get when COVID hit due to changes in transportation schedules and store closings, and reduce travel times for people in these communities to retrieve things like food and other necessities or even work.
This map depicts the San Francisco metropolitan area that includes the counties of Contra Costa, San Mateo, Alameda, Marin, and San Francisco. Including these counties that are around San Francisco is essential because the public transportation in this area connects people to different counties and serves those who live outside of San Francisco. This map shows the number of people in the San Francisco County with a household income of less than $25,000 by census tract. The darker colored tracts on the map signify greater numbers of low-income individuals, which are clustered towards city centers. Most of these areas are in San Francisco and Oakland, Alameda. On this map, a layer that pinpoints the Bay Area rapid transit locations is added on top of the low-income map. As seen on this map, the darker colored areas that represent greater numbers of low-income individuals are also the same areas where BART stations are located. An inference to be made by this is that BART stations most likely serve concentrations of low-income individuals who live within the vicinity.
Before COVID-19, the economy of the San Francisco metropolitan area was relatively strong. About 95% of industry sectors were experiencing strong growth between 2009 and 2019, 45% of which were experiencing strong growth. That is, these industries were increasing in terms of their GDP outputs and number of jobs. In contrast, the mining sector was the only one to be in decline. During the pandemic, majority of industry sectors in San Francisco were still growing. 90% of industries were experiencing growth, 5% were in decline, 5% were on the cusp of strong growth and strong decline. Majority of these industries remained in the same quadrants they were in before the pandemic. However, many of the industries in the strong growth quadrant experienced reductions of the location quotients, but still continued to grow. Overall, the information and technological sectors contributed the most to the local economy. These sectors had a concentration of jobs that were more than double the national average and in high contributions to the GDP both before and during the pandemic. The 5 industry sectors that faced the greatest impact from the pandemic are as follows: the information industry, the arts and recreation industry, manufacturing, accommodation and food services, and then other services. However, these industries were not all impacted in the same way. For example, some industries like the information and accommodation services experience a greater change in their location quotients, which is the number of jobs, rather than their GDP outputs. Thus, the pandemic likely had a differential impact on each industry. While the PICS model looked at industry and GDP concentration in relation to the overall United States, it is imperative to look at these variables in relation to the exact number of jobs and GDP output lost or gained in the region. Here, each industry is listed in order of greatest change from the PICS analyses. The information industry was the only one to have grown in terms of number of jobs and GDP. Specifically, they gained a few thousand jobs and several millions in GDP output. The manufacturing industry increased in their GDP output, but not much in terms of their number of jobs. This is likely a result of the increased production towards PPE and medical equipment to address the needs of pandemics. The accommodations and arts industries saw dramatic reductions in terms of their number of jobs and GDP outputs. These industries are directly related to tourism, which is a key part of the area's economy. Due to the mandated restrictions on travel and social gatherings, the tourism industry severely underperformed in 2020. In turn, this likely resulted in the losses of tons of jobs and economic GDP output.
Overall, there was a decrease in public transit usage from 2019 to 2020 due to the COVID-19 pandemic. The largest decrease of public transit usage is within the management, business, science, and arts occupation by approximately 17,000 people. The next largest decrease in public transportation usage is within the service occupations, along with the sale and office occupations at a change of over 7,000 people. Almost all of the occupations listed experienced an increase in workers who worked from home. The most drastic change in the number of people who worked from home before the pandemic is within the management, business, science, and arts occupations, which is at a difference of approximately 90,000 people. Another notable difference to mention is the increase in the number of people who worked from home within the sales and office occupations by over 12,000 people. However, only about 7,000 people in that occupation stopped taking public transportation to work. An inferred explanation of this discrepancy would be that people in this occupation use other forms of transportation that can include rideshare services, private transportation, and other forms of active transportation.
Before the pandemic, San Francisco had an expansive public transportation system. Although it was not perfect, routes were prevalent all throughout the city, and many affordable housing locations had direct access to numerous bus routes. However, the frequency and number of bus routes were greatly reduced due to the pandemic. In the city's decision-making process, they were guided by an equity process that focused on improving transportation performance in areas with high populations of low income and minorities. However, the city still altered 59 bus routes, and a majority of which were located downtown and in the surrounding neighborhoods. These are areas with high populations of low income and minority residents. As part of this strategy, the city aimed at ensuring that these populations would still be within a quarter-mile radius of a bus stop. Yet many of these affordable housing units lost direct access to the bus routes due to these reductions in service. While many affordable housing units were still in this quarter-mile radius, not all of them were. And those that were, their commutes to the bus stops likely increased. While the routes still existed in all parts of the city, many parts of the city, like in the Southwest, were left with only just a few routes, thus making accessibility in these neighborhoods more challenging for those low-income and minority populations. Overall, many of the routes that remained were along major transportation corridors, leaving out many of the smaller routes that once existed in 2019. Furthermore, all the routes that connected San Francisco County to Marion County were no longer in service. Consequently, these route changes had hindered transportation access to employment opportunities for many individuals.
All right, so the immediate consequence of the pandemic on public transportation was the impact on ridership. There was a steep decline in ridership and revenue that will take many years to recover. The San Francisco Transit Agency weekday transit exit graph shown here reveals that despite it being nearly 2 years since the city went into lockdown, the best month for transit ridership since then was still over 30% less than February 2020. And to be exact, it's more 34%. So what comes of this? The ridership decline has a negative impact on the economy in San Francisco as public transportation makes a profit from the excessive amounts of passengers who board transit each day. This means that when ridership numbers are low, revenue diminishes, which leads to budget cuts, which then leads to the loss of jobs in transportation, which leads to accessibility and equity concerns. The positive that can be taken from this is the congestion costs, which were decreasing as a result from the less traffic, as seen in this congestion graph. This congestion graph shows costs cut in half from 2019 and 2020 due to the pandemic. But that being said, the economic stability has not recovered since transit revenue is now plummeting. Now let's move on to the policy changes that occurred. The first and biggest policy change was the stay-at-home order. This lockdown policy was to keep non-essential workers inside their homes and to stop the spread of COVID. This policy change was an immediate consequence of the COVID-19 pandemic and had dire consequences on the transportation system in San Francisco. The order went into effect in the middle of March and stayed in place until May 25th in the same year, which was 2020. Another policy change would be the Slow Street program. This policy was a program designed to create safe transportation and to address equity concerns. The program limits traffic on some residential streets and increased walk and bike scores. Vision Zero was another policy that was implemented. This policy was implemented in February 2021. It was designed in order to create more street safety and increase the amount of bike lanes. The shifts in public transportation led to equity concerns rising throughout San Francisco. Some of the crucial equity concerns were accessibility issues, which accelerated once the protocols came into effect. One of the changes that led to inequity would be the accessibility of transit riders. When transit became accessible, less accessible, the more low-income residents suffered the most, as they are used to having public transportation, as they use it more than those of higher income. The lack of access to jobs, grocery stores, and necessary destinations reduced substantially. Those with disabilities also had trouble getting assistance with public transportation. This equity imbalance that had taken place had a detrimental impact on the economy when revenue began to plummet. When public transportation is deemed unreliable, people turn to alternative sources to get where they need to go. Ridership begins to decrease. When ridership numbers are down, the regional economy loses revenue. To ensure this does not continue to happen, prioritizing the creation of more equitable cities will bring in more money in more ways than just one. Planning for transportation has immense equity impacts that directly affect the regional economy. So being aware of these growing concerns can help the economy experience more growth and less failure.
Here you'll see what industries our survey respondents from San Francisco worked in. Prior to the pandemic, none of our respondents were working from home. However, you'll see a large shift where 83% of them during the pandemic did work from home, with only 17% of them not working from home. You'll see though, when asked if they're still working from home, that there is pretty much an even split between the three options, which is yes, they still work from home, no, they are not, or whether or not they're working in a hybrid situation. Our average commute time for individuals within San Francisco was between 20 to 30 minutes. It's also good to note that our survey respondents for San Francisco all used a personal vehicle to commute to work. Our interview subject for San Francisco worked as a physical therapist at an outpatient clinic. They expressed the issues that San Francisco had were specifically with their north to south transportation for both private vehicles as well as with public transportation routes. They also spoke about the Safe Streets program in San Francisco and how that impacted their commute negatively by increasing commuting times along what is called the Great Highway. Work-related precautions that were taken at this individual's workplace were standard with other healthcare facilities. However, they noted that as the pandemic has gone on, there's been many frustrations as the protections are still in place now that the pandemic sort of protocols have become either normalized or more workplaces are returning to pre-COVID standards.
We will now discuss some policy recommendations that we have for San Francisco in both the short term and the long term. With ridership numbers for SFMTA expected to take years to recover, these short-term policy recommendations are aimed to increase ridership in public transportation. This will provide an economic boost to lost revenue while cutting down on congestion costs, which San Francisco is expected to experience an uptick in the coming years. First, an increase in parking fees would help balance the lost revenue in transit fares, with the added bonus of incentivizing bus ridership. Expanding programs such as Drive and Ride, which allows people to drive and park at bus stops, would be another incentive for people to use public transportation without being entirely reliant on it. The SFMTA offers discounted rides to seniors and low-income individuals. To help alleviate congestion costs, we recommend expanding these discounts to the city's bike share program. The city has already increased the number of dedicated bike lanes in the city during the pandemic, providing a unique opportunity to promote biking to more people at a more affordable rate. The city's car share program, which allows low-income residents to access more places that are not connected via public transportation, should be expanded on. Being mindful that this is counterintuitive to cutting congestion costs, expanding this program should only be considered a temporary measure, and, if possible, providing electric vehicles for this service is recommended. One experimental measure the SFMTA can implement would be offering highly discounted fares for public transportation during high congestion events. San Francisco 49ers games are notoriously high congestion events within the city, and any measure that can be taken to decrease the number of cars on the road should be taken advantage of. Offering substantial discounts in public transportation fares during these events would incentivize their usage, especially among those who would not normally use the service. Our longer-term policy recommendations address deeper-rooted issues regarding equity and accessibility. During the pandemic, many of the workers who normally depended on public transportation to commute to work have transitioned to working from home or remotely, especially in the tech and information industry. While some firms intend on returning to an office environment, many intend on keeping a remote or hybrid working environment. This provides SFMTA an opportunity to assess changes in travel patterns and commuting demands and adjust the routes to accommodate these changes efficiently. In our analysis, we found that one of the most common complaints from residents regarding public transportation was the lack of communication from SFMTA regarding changes in bus routes and scheduling. Improving communications, including physical postings of changes at stops, would help residents and visitors better plan their trips and commutes and help alleviate issues of food insecurity that were experienced during the pandemic. We also recommend the city continue its Safe Streets program, as it allows more walkability within the city and is especially useful for those with disabilities. However, as we saw in our survey analysis, Safe Streets did contribute in increased congestion and commuting times for people with personal automobiles. We recommend the city closely monitor Safe Streets and perhaps adjusting its timing and placements to reduce congestion costs while providing a useful system for those who use it.
So now we will talk about data and policy within Syracuse, New York, in regards to public transportation. So here is a study area map that depicts Syracuse metropolitan area, which is our study area, and this is shown through the Syracuse city shape boundary file. There are other areas outside of Syracuse that are shown on the map, such as Onondaga Lake, Solvay, East Syracuse, Minoa, Fayetteville, and Nedrow. And also within Syracuse, this includes West Side, North Side, East Wood, and South Side. These areas are shown to show whether transportation is provided to areas within Syracuse, but also outside Syracuse to determine whether the connectivity from one place to another exists and whether it is utilized. So here is a map that depicts an income map of Syracuse with a household income of less than 25,000 by census tract. The darker colored tract shows that there are many people that are considered low income, and there's a greater concentration as shown in the center and south of Syracuse. There are also central bus stops that are presented on the map because Syracuse does not have its own subway system. The census tracts with a darker shade have more central bus stops within the center of Syracuse compared to outside of the center of Syracuse, where there is less of a concentration of central bus stops.
And here is the PICS model for the Syracuse metropolitan area. Among the local 20 NAICS industries, the top 5 industries which are greatly impacted by the COVID are accommodation and food services industry, other services industry, wholesale trade industry, arts, entertainment, and recreation industry, and information industry. Except for other services industries, all the other industries are showing decline in location quotient and GDP quotient, which means they are hiring fewer people and experience a decline in economic output during the COVID. There are also industries experiencing a growing trend, such as other services industry and utility industry. But overall, based on the comparison between industrial economic situation points on the graph, the economic conditions of most of Syracuse industries before and during the pandemic were not significantly different. The pandemic doesn't have a huge impact on most local industries of Syracuse.
While we recognize that COVID-19 cannot be the sole explanation for any industrial changes in the Syracuse area, we feel confident in asserting that any industry that significantly departed from its pre-pandemic economic trajectory likely was influenced by the emergence of COVID-19. As a prerequisite to the following data, we found during our research that many values for industries were missing throughout the data set and attempted to estimate those missing values. In finding that some of our initial top 5 industries had the highest amounts of estimations, our final considerations had values within the dataset that had no estimations at all. We felt this would provide more tangible evidence in relation to the report and all consequential recommendations. This table shows the total employment and real GDP change between 2019 and 2020. Significantly, both jobs and GDP were lost between the 2 years and are presented respectively to where they are in the PICS model. The accommodation and food services industry had a significant overall change with a dramatic 25% job loss. This is most likely related to the national reactions to shut down restaurants at the beginning of the pandemic. Other services had a less dramatic loss of jobs and GDP, as did wholesale trade and information. Another large change in employment and GDP was the arts, entertainment, and recreation industry, as most of their events prior to the pandemic were in person. Hollywood, Broadway, and especially small local theaters all shut down, resulting in job losses and economic output. From this graph, we noted that while there was a significant increase in occupations that transitioned to a work from home model, most of these industries had already been working remotely, as shown by the 2019 data. The occupation category that nearly doubled in working from home is management, business, science, and arts. We can assume that because the arts and entertainment industry had to begin primarily working from home, this was the cause of the severe increase during the course of the pandemic. We were surprised to find that service, sales, and office occupations did not have as much of an increase in people moving to remote work. And in consideration with how many people work in those industries, it can be assumed that everyone who did not move to remote work would be considered essential worker. This bar graph shows that the number of people who utilized public transportation prior to the pandemic were higher overall than mid-pandemic figures, likely due to a combination of switching to remote work or loss of employment. The service occupations group was the only one that increased in use of public transportation commuting during the pandemic. During the first few months of 2020, Centro waived its bus fares, stating that it helped to ease the burden placed on commuting essential workers. This policy may have helped retain some of its ridership loss as a result of public health fears and the increase in remote work for non-essential workers. Additionally, service workers who did not previously use public transit to get to work may have been more motivated to do so without bus fare as a financial barrier. Lastly, a possible shift away from carpooling in order to socially distance oneself may have forced some to public transportation.
So this map represents average commute time and reliance on public transportation from 2019 to 2020. The map representing the 2019 of people who rely on public transportation and the average commute time within Syracuse can be seen on the left. There's a high concentration of multiple darker shades of people who rely on transportation south of Buffalo, while the northeast and west of Buffalo have lighter shade census tracts, which has fewer people that rely on public transportation. Also, there are higher graduated symbols for an average commuting time within all directions of Syracuse. There are a lot more graduated symbols representing 17 to 26 minutes within Syracuse. This also represents that a lot of places within various census tracts of Buffalo require a minimum around 17 minutes in most places to travel to their destination and a maximum time of 26 minutes. And on the right is the 2020 map that also represents public transportation that people rely on and the average commute time. If we compare this to 2019 map for people who rely on public transportation and the average commute time, there was an increase in terms of commute time and the reliance on public transportation. The changes that were shown can be seen west and north of Syracuse, where people rely on public transportation, as there have been changes from a lighter shade to a darker shade based on their census tracts. This shows that people started depending more on public transportation within those areas. In addition, the dependence on public transportation leads to a change in greater commute time, as some of the smaller circles have changed to bigger circles, as you can see from 2019 to the 2020 map. The changes can be correlated with the next visual representation, which will also give insight into why the commute time has increased because of the changes in the central routes. So here we have a 2019 map and 2020 map representing household income, central route, and affordable housing. On the left is the map that represents 2019 household income of less than 25,000, central routes, and affordable housing. Based on the data portrayed on the map, it is unusual, but there is a high concentration of affordable housing shown within the lighter shade of census tracts located southwest. Although there is a higher concentration of affordable housing within the center of Syracuse located within the darker shade of the census tracts, there are a lot of central bus routes located northwest where there's a lighter shade of low-income census tracts compared to the dark shades of the census tract located southeast. Also, a lot of the central routes do intersect with one another within the center of Syracuse, where it falls within the darkest shades of the census tract. And the map on the right depicts a 2020 household income of less than 25,000, the central route, and a housing map, an affordable housing map. The data portrayed on this map displays that affordable housing is highly concentrated within the center of Syracuse, with a few stranded affordable housing points falling outside the center of Syracuse and located within a medium and lighter shade of residents earning less than 25,000. However, there are various amounts of census tracts that have darker shades that have less than 2 points of affordable housing located outside the center of Syracuse. There's a high concentration of residents earning less than 25,000 that is represented by a darker shade within the census tract located at the center, east, and south of Syracuse. In addition, there have been central routes that were suspended that can be seen from the 2019 household income of less than 25,000 central routes and affordable housing map. There are fewer central routes located in northeast and south of Syracuse where there are medium and darker shades of low income. There's also still a high concentration of central routes located in northwest and central Syracuse that overlap census tracts that have a darker shade of low income. So overall, the data collected between both maps, 2019-2020 maps, in regards to a household income of less than 25,000, central route, and housing, affordable housing, have shown changes within the span of a year. There have been central routes changes where multiple lines were suspended during COVID-19 in 2020. As a result, many of these central routes were suspended within medium to darker shade census tracts where there's a high concentration of people who have a household income of less than 25,000. Transit-reliant workers that lived outside the center of Syracuse are disproportionately impacted since central routes were cut, affecting their way to travel to their jobs and other destinations. There also isn't much of an alternative method of transit accessibility since Syracuse does not have a subway system. Also, rideshares such as Uber would less likely be around the outskirts of the center of Syracuse, since the areas that have suspended central routes are within the darker shade of low-income census tracts, which would mean that more likely that accessibility to those who live closer to the center of Syracuse would be easier to gain access of, while areas that are profitable with a higher concentration of workers request a ride from rideshares. In addition, this would affect transit-reliant workers within the low-income areas because of the lack of reliability and accessibility to provide options for people to travel from one area to another, which also forces transit-reliant workers to make a choice whether to pay a higher fee than what they would usually pay to commute by taking a rideshare or to become unemployed due to a lack of alternative commuting options.
One significant challenge we encountered with Syracuse is that as a small city, there's very limited data available, both on transit ridership and on the impacts of COVID-19 overall. Whereas in New York and San Francisco, there are already municipal reports, as well as academic research available on the ways the pandemic has affected public transportation and commuting patterns. Syracuse is a bit more elusive. Our understanding of Centro was primarily pieced together using their board meeting minutes, several local news articles, and financial reports from the Syracuse Metropolitan Transportation Council, the presiding MPO. We extensively reviewed relevant planning documents from a variety of local organizations, the majority of which were written before the pandemic, and received little update to reflect the changes that have occurred since 2020. We hope that by examining these regional plans in tandem with our necessarily piecemeal collection of transit data, we can still produce a sufficient narrative of what is taking place in Syracuse and make useful policy recommendations in consequence. While no comprehensive or continuous figures are publicly available on how the bus ridership changed during the pandemic, we did learn that in the weeks immediately after the statewide shutdown, Centro's ridership declined by 55%, a major hit to the system, but still far less than what occurred in New York and San Francisco. It did, however, seem to struggle more over the long term, with the 2020 fiscal year seeing a 66% decrease in ridership overall. And that's just for the fixed route buses, with paratransit and special contract lines factored in, the latter of which contributes almost twice to Centro's revenue what the standard passenger lines do. The decline is even more dramatic. Ridership numbers have been trending upward since last spring, but Centro is still only serving about half the number of bus users than it was in 2019, with no expectation from the board for it to return to pre-pandemic performance within the next couple of years. It is important to recognize, though, that Centro was already experiencing declining ridership prior to the shutdown. Centro is highly dependent on state and federal subsidies for operations, and funding issues in 2011 led to route cuts and a fare hike that the organization never fully recovered from. Centro was quick to waive its bus fare at the start of the pandemic in order to minimize commuting barriers for essential workers. At that time, the organization announced that it expected to fully maintain its regular service level. As the severity of the COVID-19 crisis set in, Centro was forced to reverse course, suspending several of its lines and switching to a reduced frequency bus schedule just a few weeks later. By August, all buses had been outfitted with protective services, and electronic fare collection launched in July of the next year. Still, Centro yo-yoed every few months between cutting its less used routes, often the ones connecting small towns to the city, and later reintroducing them. Similarly, the frequency of service has been modified multiple times. This is due not just to low ridership, but because of the short staffing of essential workers. Throughout the pandemic, the system has routinely been operating about 40 drivers below necessary service level requirements, partly due to absences from COVID-19, but long-term from low application rates. Most recently, Centro is planning to universally reduce its fares, but simultaneously waive its policy that allows for free transfer between buses, stating that only 20% of its users need to make transfers to reach their destination. While Centro's buses are the sole mode of public transportation available in the metropolitan area, the city of Syracuse reintroduced its bike share program in September of last year in an effort to promote alternatives to car travel. The program initially launched in late 2019, but was suspended when the bike provider permanently ceased operations due to COVID. With the relaunch of the bike share and addition of e-scooters, the city hopes to increase non-vehicular commuting and is offering cost waivers to low-income users. In 2015, Syracuse was found by one nonpartisan think tank to have the highest concentration of African American and Latinx residents living in poverty in the 100th largest MSAs. Another study shows that between 2009 and 2019, the Syracuse metropolitan area was among the worst performers nationally in overall job growth, racial inclusion, and geographic inclusion. In 2018, a survey conducted internally by Centro showed that the majority of respondents on 19 out of 21 bus lines self-identified as being low income, a person of color, or both. 66% of all respondents said their primary use of the bus was commuting to a job. All of these figures become incredibly important in weighing the impact of Centro's response to the pandemic. In an MSA where in 2015, 78% of commuters drove to work alone, it becomes dangerously easy to marginalize the relatively small number of transit-dependent individuals stranded in a city of drivers. Pre-pandemic, bus frequency was identified across multiple local transit studies as the biggest concern to Centro riders, especially limited service at night and on weekends. Transit access within the suburbs, particularly those north of the city, has also been noted as a major challenge to those needing to commute into the city for work. The recurring fluctuation of Centro's bus schedules in the wake of COVID has undoubtedly exacerbated these concerns. Further, the impending elimination of free bus transfer is likely to add a cost burden to the people who require more than one bus trip to reach their workplace. The SMTC's task of providing accessible services will likely become more strained in the future as the residential population continues to sprawl outward, but the overall population remains stagnant. Not to mention the pandemic relief sources that are currently fueling Centro operations will at some point stop paying out. Upcoming major transportation projects, however, may offer an opportunity to correct insufficient transportation infrastructure that has isolated low-income communities, spatially and economically. By removing the viaduct section of the Interstate 81, Syracuse will soon rebuild an at-grade street network called the Community Grid in the hopes of increasing economic development, walkability, and public green space. A second transportation project, still in its planning stage, is the addition of 2 bus rapid transit lines along the most heavily traveled corridors in the region. Not only is significant job growth anticipated in the corridors over the next 30 years, but 50% of the city's population lives among them, potentially giving many city residents without vehicles improved access to job opportunities.
Our survey respondents for Syracuse, New York varied in what type of industries they worked, with the majority of our respondents coming from educational services. Prior to the pandemic, none of our survey respondents for Syracuse, New York worked from home. However, during the pandemic, we had 50% of them working from home and around 40% of them not working from home. Someone indicated that they switched jobs, which did impact their answer. Currently, most of our survey respondents are not working from home, with 20% of them working hybrid and 20 of them still working from home. Our average commute time in Syracuse, New York was between 0 and 20 minutes, following with 20 to 30 minutes, and then 45 to 50. Just like San Francisco, all of our survey respondents for Syracuse, New York indicated that they used a personal vehicle as their mode of transportation for commuting. When asked whether or not individuals changed jobs in Syracuse, a majority, about 70% of our respondents said yes. We had someone who changed jobs, but within the same organization, someone who moved from Long Island to Syracuse, working in finance previously, but still working in the finance industry. And another person graduated from college and transitioned from their part-time job to a full-time job following their graduation. Unfortunately, we are unable to conduct interviews with Syracuse survey respondents.
Based on our findings regarding the pandemic's economic and transit-related impact on the Syracuse area, we'd like to offer some policy recommendations that may help Centro and the SMTC deal with the current challenges they are faced with and perhaps become more resilient to crises like COVID-19 in the future. One of the greatest obstacles to maintaining pre-pandemic service levels, for example, has been the staffing of bus drivers. Centro should continue its current hiring push and the streamlining of training programs by targeting recruitment efforts in underemployed communities and do so in close communication with job equity-focused organizations like the Onondaga Citizens League. In instances where bus cuts are unavoidable due to staffing deficits or otherwise, Centro could work with the city government as well as local nonprofits to plan for short-term support for commuters who unexpectedly find themselves with no way to work. This could take the form of temporary rideshare vouchers or a sort of triage commuter shuttle, the need for the latter having been demonstrated by the efforts of a nonprofit called Providence Services, whose Ride to Work program ran for several years but recently ceased operations due to its own driver shortage and the rising cost of gas. In a 2021 study with the New York State Department of Transportation, the SMTC determined that the city's current bike infrastructure was moderately used, but had the capacity to accommodate additional traffic. The MPO should leverage this by partnering with major employers situated near existing bikeways to develop bike to work incentives. If additional lanes become available in the future, as is currently proposed under the community grid plan, the city's new bike and e-scooter program should be expanded in relation. While encouraging more active and inexpensive commuting methods is ideal, the most impactful strategies in the short term will be the ones that work with the prevailing car culture of Syracuse. We recommend a public-private partnership wherein the city can pursue tax breaks for TNC drivers who participate in programs that get low-income employees to work. Another alternative is for a municipal Wheels to Work program that assists low-income workers who don't have transit access fund the purchase and maintenance of a personal vehicle for commuting purposes. We offer these suggestions with the caveat that funding such projects is very difficult for a small and heavily subsidized transit authority like Centro. For that reason, the above solutions will likely need to be paired with revenue-producing ones, such as monetizing the currently free circulator bus, which runs in loops through the downtown core, and seeking out additional special contract lines, such as that which runs for the state fair, to both facilitate local tourism and events and diversify Centro's revenue stream. Long term, we believe one of the best things Centro and the SMTC can do to fortify itself against major disruptions like COVID is to learn from local coalition approaches used elsewhere. Special interest groups like the Syracuse Onondaga Food Systems Alliance and the Manufacturers Association of Central New York both leveraged their networks to minimize industry losses when the pandemic hit. The SMTC could similarly build a coalition of municipal, planning, and community leaders to quickly tap into when emergencies demand it. Additionally, transit-oriented development should become a top priority for city developers, especially as new opportunities emerge with the Interstate 81 project and the future of bus rapid transit. By thoughtfully coordinating transit stops with jobs and retail storefronts, especially with the region's most struggling industries prioritized, Syracuse can improve employment access, create industry-specific growth initiatives, such as recruiting workers in the hard-hit arts sector to participate in streetscaping, and combat the developmental sprawl that is increasingly straining its transit system. It should, however, include within this a community benefits agreement and a move towards equity rather than gentrification. As our last policy recommendation for Syracuse, we'd like to suggest increasing public access to data collected by Centro and the SMTC. Though we suspect that this may be a result of having fewer resources to devote to analyzing and disseminating information compared to larger staffed planning offices in New York and San Francisco, putting the effort into doing so could produce creative solutions to Centro's problems.
We will now discuss the overall policy recommendations that we believe are applicable to the three cities discussed in our report. First, given the disruption of the pandemic, many cities were forced to adjust their public transportation schedules and networks, which were poorly communicated to the public. We recommend cities put in effort to better communicate future changes, so residents are better equipped to plan their routes ahead. Second, while the COVID pandemic disrupted American public transportation in unprecedented ways, it is clear that our cities were ill-prepared for its effects. We recommend cities develop through emergency plans to ensure its resiliency and proactiveness in case of future disasters. Finally, as city transportation departments seek an economic boost to make up for lost revenue, it is important to keep transit fares affordable to ensure equitable access. We recommend incentivizing public transportation use by offering discounted fare prices for demographics such as low-income families and senior citizens, or further expanding existing discounts to include more people.
Pre-COVID-19, our three widely varying cities had few commonalities, and these variances included the use of public transportation throughout the city. Each city's transit use has drastically changed since the pandemic hit, largely due to industry changes, social distancing, and many more policies introduced to keep civilians safe. It is no surprise that those relying on public transit would be directly affected by this, resulting in essential workers and low-income and disadvantaged populations to have the most adverse effects. The pandemic truly exacerbated the equity issues within each city and their respective transportation systems. While all of our information was reliant on the limited availability of data, through our analysis of economic factors, we found that each city experienced significant job loss. This loss was primarily in arts, entertainment and recreation, accommodation and food services, and other services. Only San Francisco saw an increase in GDP and employment in the manufacturing field, whereas New York City and Syracuse had a decline in employment across all 5 of their top industries. All 3 cities also saw a large increase in remote work at the start of the pandemic for varying occupations, though this tapered off for those in service, construction, and maintenance occupations. In perspective of what the pandemic actually is, a virus running rampant across the globe, we must offer the simple but weighted question of whether or not these employment and transportation numbers are influenced not by a simple job loss or stay-at-home mandate, but because of deaths or disabilities caused by the virus. Under the assumption that they are, how can these cities and other municipalities plan for something like this? In creating resiliency plans that prepare for pandemics and disasters, municipalities would be preparing to safeguard their most vulnerable communities. A future pandemic cannot be prevented or responded to without learning from our failures and making plans to ensure that they never happen again. Thank you.